Hi, my name is Bruce Trevithick with the Genesee County Medical Control Authority, and this video is designed to provide you with a brief overview of a new emergency protocol that we're putting in place in response to the pandemic. The focus of this protocol is designed to reduce the number of patients being transported to the hospital who are suspected to have or confirmed to have COVID-19, but they don't really require immediate treatment or hospitalization. So this protocol kind of categorizes patients into three categories: asymptomatic, minor symptoms without risk factors, and severe symptoms. And what we're going to be focused on here and trying to limit the patients being transported to the hospital is focused on those people who are asymptomatic or they have minor symptoms and they do not have any additional risk factors. So minor symptoms, what were we talking about here? Body aches, sore throat, headache, fever, mild nausea. But if your patients have any of these symptoms, but they have these risk factors, then they should be considered needing to be evaluated by the hospital. So over the age of 65, individuals with cardiovascular disease, COPD, diabetes or obese, people with hypertension, immunosuppressed, or those on chemotherapy. So if you have patients who have minor symptoms but have these additional risk factors, we would encourage you to transport them to the hospital. So what are you going to advise the patient? You're going to give them some information about what the medical director's standing order says. When you review the protocol, it gives you basically a script to go over with the patient. So they need to understand that if they're asymptomatic, mild symptoms, don't have any risk factors, they should stay home. They should isolate, they should rest, they should hydrate, take comfort measures, and self-monitor. And if their symptoms become serious, and there is a list of serious symptoms noted in the protocol as well, they should call 911 back. Now, what should you do as an EMS provider once you've communicated this to your patient who is asymptomatic or mild symptoms without risk factors? Well, if the patient says they still want to go to the hospital, you have an obligation to transport them to the hospital. We're not trying to unduly influence individuals who want to be evaluated by the ED. All right, so transport the patient if they request to do so. If the patient does follow the orders that the medical director is recommending, then advise the patient of the severe symptoms that are noted in the protocol. And then obtain a signed refusal if they're willing to follow that order. And then document that you've given the patient all of these instructions, that you've told them why they're being asked to stay at home, and what they should do if their symptoms worsen. And then provide them with information on monoclonal antibodies. If you're not aware of monoclonal antibodies, it's a great therapeutic treatment for individuals who are experiencing COVID. And the state has a very good website that allows them to identify locations where they can obtain those antibodies. In some cases, they will need to have their primary care physician referral for that. In other cases, the sites will actually do the evaluation right there and be able to treat them. All right, so this gives you a brief overview of what this protocol is going to do. I strongly encourage you to read over the protocol, and if you have questions, feel free to contact us or Dr. Burgess, who is the medical director instituting this protocol under his emergency authority. Thank you very much.